An introduction: imagine looking at the world through a frosted window, where the clarity slowly fades, replaced by a web of hazy lines. This is a glimpse into the world of someone living with lattice corneal dystrophy. This rare, inherited eye disease affects the cornea, the clear front window of your eye, and can significantly impact vision over time. Join us as we delve into the complexities of lattice corneal dystrophy, exploring its causes, symptoms, diagnosis, and the available treatments that can help manage this challenging condition. Etiology: causes lattice corneal dystrophy is primarily caused by a genetic mutation, specifically in the TGF-beta gene, which stands for transforming growth factor beta-induced. This gene provides instructions for making a protein called keratopathelin, which plays a critical role in the structure and function of the cornea. The mutated gene leads to the production of an abnormal keratopathelin protein. This abnormal protein accumulates in the cornea, disrupting its normal architecture and leading to the formation of distinctive lattice-like deposits. This genetic mutation is inherited in an autosomal dominant pattern, meaning that if one parent carries the mutated gene, there is a 50% chance that their child will inherit the condition. Pathophysiology: the pathophysiology of lattice corneal dystrophy centers around the accumulation of abnormal amyloid deposits within the corneal stroma. The abnormal keratopathelin protein, produced due to the genetic mutation, misfolds and aggregates, forming amyloid fibrils. These amyloid fibrils deposit in the stroma, which is the thickest layer of the cornea. These deposits disrupt the smooth, regular arrangement of the collagen fibers in the stroma, causing clouding and scarring. Over time, these deposits enlarge and coalesce, forming the characteristic lattice-like lines that give the disease its name. The deposits can also erode through the overlying epithelium, leading to recurrent corneal erosions, which are painful and can further impair vision. This ongoing process ultimately compromises the cornea's transparency and refractive properties, leading to visual impairment. Epidemiology: lattice corneal dystrophy is a relatively rare condition. While exact prevalence figure difficult to obtain, it is estimated to affect a small percentage of the population worldwide. The prevalence can vary depending on geographic location and population demographics. Some studies suggest a higher incidence in certain regions or among specific ethnic groups. Because it's a genetic condition, it can occur in any population, but is more common in families with a history of the disease. It typically presents in childhood or adolescence, although some individuals may not experience noticeable symptoms until later in life. Signs and symptoms: the symptoms of lattice corneal dystrophy can vary depending on the severity and stage of the disease. In the early stages, individuals may be asymptomatic or experience only mild visual disturbances, such as glare or halos around lights. As the disease progresses, the lattice-like lines become more prominent and can cause blurred vision, decreased visual acuity, and distortion of images. Recurrent corneal erosions are a common and painful symptom. These erosions occur when the outer layer of the cornea, the epithelium, breaks down, causing sharp pain, light sensitivity, and excessive tearing. These erosions can occur spontaneously or be triggered by minor trauma to the eye. In advanced stages, severe corneal clouding and scarring can lead to significant vision loss, potentially requiring corneal transplantation. Diagnosis: diagnosing lattice corneal dystrophy involves a comprehensive eye examination. A slit lamp microscope is used to closely examine the cornea and identify the characteristic lattice-like deposits. These deposits appear as clear or grayish lines that intersect and branch out across the cornea. Corneal topography can map the corneal surface, revealing irregularities and distortions caused by the deposits. Confocal microscopy provides a high-resolution view of the cornea, allowing for detailed visualization of the amyloid deposits and other structural abnormalities. Genetic testing can confirm the diagnosis by identifying the specific mutation in the TGF-beta gene. This is especially useful in cases with atypical presentations or when a family history of the disease is present. A corneal biopsy, where a small sample of corneal tissue is removed for microscopic examination, can also be performed to confirm the presence of amyloid deposits. However, this is typically reserved for complex or unclear cases. Classifications: types. While the classic lattice corneal dystrophy is generally referred to as type I, it's important to note that there are variations in related corneal dystrophies linked to different mutations in the TGF-beta gene. These include lattice corneal dystrophy type 2E, also known as Maratoja syndrome, which involves systemic amyloidosis in addition to corneal involvement. Type I typically presents with cranial neuropathy, facial skin laxity, and low corneal sensitivity. Other rarer variants exist with slightly different patterns of amyloid deposition or associated systemic features. These classifications are based on the specific genetic mutation and the associated clinical presentation. A treatment and management. There is currently no cure for lattice corneal dystrophy. The goal of treatment is to manage symptoms and improve vision. For mild cases with minimal symptoms, lubricating eye drops and ointments can help alleviate dryness and discomfort. Bandage contact lenses can protect the cornea and promote healing in individuals experiencing recurrent corneal erosions. Debridement, a procedure to remove the damaged epithelium, can provide temporary relief from recurrent erosions. Excimer laser phototherapeutic keratectomy, or PTK, can remove superficial deposits and smooth the corneal surface, improving vision and reducing the frequency of erosions. However, PTK only provides temporary relief, and the deposits will eventually reappear. In severe cases with significant vision loss, a corneal transplant, also known as penetrating keratoplasty or lamellar keratoplasty, may be necessary. This involves replacing the damaged cornea with a healthy donor cornea. While corneal transplantation can restore vision, it is a major surgical procedure with potential complications, such as rejection, infection, and glaucoma. A prevention. Since lattice corneal dystrophy is a genetically inherited condition, there is no way to prevent it from occurring in individuals who have inherited the mutated gene. However, genetic counseling can help individuals with a family history of the disease understand their risk of inheriting or passing on the condition to their children. Preimplantation genetic diagnosis, or PGD, is an option for couples undergoing in vitro fertilization. PGD allows for the selection of embryos that do not carry the mutated gene, preventing the disease from being passed on to future generations. While not a direct prevention of the disease in an affected individual, these measures can help reduce the incidence of lattice corneal dystrophy in future generations within affected families. Prognosis, recent research or advances. The prognosis for lattice corneal dystrophy varies depending on the severity of the disease and the effectiveness of treatment. While the disease typically progresses over time, many individuals can maintain functional vision with appropriate management. Corneal transplantation can provide significant vision improvement, but long-term success depends on factors such as graft survival and the absence of complications. Recent research is focused on developing new therapies to prevent or slow the progression of the disease. Gene therapy, which involves delivering a normal copy of the TGFBI gene to the corneal cells, is a promising area of research. Other potential therapies include drugs that can prevent the formation of amyloid deposits or promote their clearance from the cornea. Researchers are also exploring new surgical techniques to minimize corneal damage and improve transplant outcomes. These ongoing efforts offer hope for more effective treatments and a better prognosis for individuals with lattice corneal dystrophy.